This is Altura Now with Nicola Burton.
As the COVID-19 situation evolves, Altura aims to keep you up to date with the latest information, and today, Sean Rooney, CEO of Leading Age Services Australia, joins me from Canberra to talk about actions in the residential aged care sector. Sean, thanks for joining us.
It's a pleasure to be here.
Sean, borders are closed, travel's restricted, and many people are now self-isolating. How critical is it for the protection of older Australians, especially in aged care?
Look, it's an issue of national importance to protect vulnerable older Australians in residential aged care. The primary focus of national importance is to slow the spread of COVID-19 in the community because, as the Prime Minister has said, slowing the spread saves lives. So our focus in residential aged care is to protect older Australians in care, but also to protect the passionate and professional workforce that cares for them.
Over the last week, we've seen restrictions imposed on aged care in regards to visitors. Can you tell me how important they are?
Well, they are fundamentally important for the protection of older Australians and the workforce. We know that if COVID-19 infections have an outbreak in residential care facilities, from international examples, the impact can be catastrophic. So it's of fundamental importance that whilst the aged care sector does all it can to protect older Australians in care and also the workforce, it's a community responsibility to adhere to the guidance and the restrictions to visitation to make sure that we can best care for their loved ones.
And we know that each state and territory may have rules that might be slightly different to federal restrictions. It's important that organisations are familiar with both.
Look, that's correct. So the recommendations and the guidance from the Prime Minister was agreed at the National Cabinet, and that was based on the advice of the AHPPC. These are the medical professionals advising governments. Now, the measures that were put in place were the minimum restrictions to visitation, and in discussion with the Department of Health and also the Aged Care Quality and Safety Commissioner, it was agreed that residential care facilities may put in additional measures where they have a clear rationale to do so based on risk, and that the implementation of those measures is appropriately communicated and with appropriate consultation with residents and their families. And we're seeing this now with the introduction of state-level guidance to residential care operators going beyond what was initially recommended and endorsed by the National Cabinet.
So we'll be talking about federal measures today. Can you run me through the latest measures that's been applied?
So there's a number of restrictions to people that can and can't come into residential aged care facilities. Certainly people with all the risk factors with regards to overseas travel, or people who have been in contact with people who have travelled overseas, or anybody with flu-like symptoms should definitely not be entering into a residential care facility. School groups have now been restricted, and as have children under the age of 16, unless in exceptional circumstances. From May the 1st, there will be no entry to people who've not had an influenza vaccination. And then those people that are coming in to visit loved ones will need to be restricted to 2 visits per day of no longer than 2 hours. And then within facilities, there's no large group gatherings of visitors or residents, and practicing all the social distancing arrangements that would be in place in the wider community. Now, having said all of that, it's important that there will be exceptions to these rules, because we know in many circumstances there will be compassionate reasons why we need to relax some of these restrictions
Such
for
as end of
residents
life.
and families. Yeah, exactly. I mean, what we have to get here right is the balance between compassionate care, but absolute vigilance and protection and caution with respect to infection control in residential aged care facilities. And operators of those facilities have been briefed repeatedly with respect to getting that balance right. I've got to say, when we've talked to providers across the country and talked to residents and families, the residents and families overwhelmingly are supportive of these measures because they can see the importance that getting this right will save lives of loved ones.
And in these difficult times, what can organisations do to ensure the mental health of older Australians, that it remains a primary consideration?
Well, this is one of the big challenges now. If we are into these situations of visitation restriction, We know that people's mental health and social connectivity are equally important as their social health needs. And so finding ways that we can ensure that residents are not feeling overly isolated, that they are having regular connections with their loved ones and with each other and with staff is really fundamentally important. And we're seeing a lot of technology measures now being put in place with the use of iPads and tablets and other screens for FaceTime and those types of ways to engage. And we've actually been quite pleased to see the response from the provider side, upgrading ICT measures to be able to enable this connectivity.
And you're creating a web page, aren't you, of resources?
Oh, yes, we've had now for a number of weeks a dedicated web page on our website. This is where we provide up-to-date information and resources to providers of aged care with respect to all the changes that have been happening. We have a frequently asked questions section that is updated on a 24-hour cycle, and we also have the ability for people to pose questions, and then we can crowdsource responses as well as get issues responded to directly by government. So that plus our daily email service providers is very popular at the moment.
It sounds like a great initiative.
Look, it's certainly been welcomed by our members because things have been changing so quickly and they've been bombarded by information. So having us sitting in between them and all the information that comes from all the different jurisdictions and us doing that, I guess, collating and basically synthesizing that information so they have a single point of information that's relevant to them has been very well received.
So slowing the spread of the virus is paramount in terms of our health systems being able to cope. What are the recommendations for the aged care sector in addressing this?
Well, the sector's been on high alert now since really January this year, and we deal in residential aged care with seasonal influenza outbreaks and gastro outbreaks and the like. And so we have already in place good infection controls. They are regulated by the Australian Aged Care Quality Standards, and that is enforced by the Aged Care Quality and Safety Commission. Notwithstanding that, as I said, we've been on high alert since January, and additional measures have been put in place, such as well before the announcement by the Prime Minister with regards to restrictions of visitations. We saw many services already screening staff and also screening visitors with respect to risk factors. We see lots of training and retraining underway, and that's with regards to infection control. We've also seen planning, ensuring that there'll be appropriate levels of personal protective equipment available, and hand sanitizer and the like, as well as also stress testing emergency plans in the event of an infection outbreak. So these are the types of initiatives that we've been putting in place in partnership with our members and the regulator and the government over the past few months to ensure we are as prepared as possible to limit the risk of infection in residential aged care.
What's your best advice for families and friends right now?
Look, I think the best advice for everybody who has someone in aged care is to play it safe. As distressing as it may be, we need as a community, as a whole society, as a nation, to respond to the direction of the government with respect to social distancing and pay particular attention and vigilance with respect to ensuring that we don't bring COVID-19 infection to residential aged care facilities. So the restrictions are clearly outlined. They'll be available at your residential care facility. We'd expect all people to be contacting their facilities and being engaged in a dialogue with regards to the particular requirements for their loved one. And where there are exceptions to the rule, as we mentioned earlier, then they should be fully explored. But please know that the primary purpose here is to ensure that we don't have infection in a residential aged care facility.
Now, we need to talk about the aged care workforce. It's under considerable pressure at the moment. What's being done to ensure continuity of care?
So workforce is critical, and as I said up front, this is not just about protecting older Australians in care, it's also protecting our workforce. They are the frontline workers who are having to deal with infection control and unfortunately in some instances infection outbreaks. So it's fundamentally important that we have supports for them right now, and I'm very pleased to be able to say that the government has acknowledged this and has come forward with significant funding packages for us to support our workforce with regards to retention of staff and also for training of staff, whilst also a number of initiatives we're working on to be able to bring additional workforce to bear in the event of an infection outbreak in the sector.
And we've had visa holders being able to work full-time hours now instead of the 20 hours.
That's right. That's one of the initiatives negotiated with government, is for overseas workers on those foreign visas. Previously, they were allowed to only work up to 20 hours per week. That's now been extended, which is great because these are experienced, skilled aged care professionals that can give even more in time of need.
Residential aged care in particular is already under significant financial distress. What's the state of the sector?
Well, a recent independent assessment of financial performance in residential aged care currently sees around 56% of facilities operating at a loss as at the end of last calendar year. And we know for facilities operating in non-metropolitan areas, that figure is up around 71%. This has been an ongoing issue for the sector for a number of years now. And we've been advocating quite strongly to government that this is an issue that we need to address. I do note in the latest independent survey, they've recommended something like $1.5 billion is required to resolve this issue. I've got to say at the moment, our focus is squarely on responding to the COVID-19 crisis, but part of that response needs to deal with the underlying financial issues in the sector.
Absolutely. Even though aged care is under a lot of pressure at the moment, we're still seeing our industry just stand up and still do wonderful things and offering that outstanding care that we are known for giving. So what are your thoughts? What are you seeing in the industry?
Look, I think it's been outstanding, the response that I've seen from industry. I've seen high levels of collegiality, collaboration, compassion and care. People working together across all elements of the services, all elements of the sector, with the primary focus, as I said up front, of protecting vulnerable older Australians in care and protecting the workforce. It's heartening to see that. And I would just want to assure everybody who's watching is that we're 100% behind our workforce. We've been on alert for quite some time now, as I've said. We're doing everything we possibly can to ensure the safety of older Australians, and everybody has a role to play in that.
And how we treat our elderly really says a lot about our society, and we need to do what we can to protect them.
That's right. As I said up front, that this is an issue of national importance. As the Prime Minister has said, slowing the spread of this disease will save lives, and many of those lives saved will be older Australians in residential aged care facilities. It's not just an issue for our sector, it's an issue for all Australians to make sure that they're doing everything they possibly can to stop the spread of COVID-19.
It's been a pleasure speaking with you today, Sean.
Thank you very much, Nicola.
I'm Nicola Burton for Altura Now. Thank you for joining us.